This is Frank Islam, Chairman and CEO of our investment group and your host of Washington Calling, where we interview leading voices from business, politics that impact you, the viewer. Today, we're fortunate to have a distinguished guest, Dr. Hussain. He's the chairman of the Fathima Healthcare Group. He is known as People's Doctor. He's a role model in the state of Kerala in India by bringing relief to the patients. He's a well-known philanthropist. He subscribed to the notion President Kennedy once said, to whom much is given, much is expected. He has received many awards for his many engagement. Dr. Hussain, welcome to our show and thank you for your coming. It's nice to meet you.
Yeah, it's really a pleasure to meet you, Mr. Frank. It's a great time and to join with you.
Thank you very, very much, Dr. Hussain. Your journey and your story is remarkable, fascinating.
Thank you.
It reminds us that your story resonates not only in the country that you are right now in UAE, but all around the world. So tell us a little bit about when did you reach the United Arab Emirates and why, and when did you found the Fathima Health Group? And as you know, you are a role model for many, many people. And tell us the missions and goals and objectives of this healthcare group. Dr. Hussain?
Yeah, it's a pleasure to talk about it. And of course, I just came here by 1990. Although I have stepped into UAE for sometimes, visit here and just prior to that. And I was practicing in India, and especially that, the South India, Kerala nearby. Okay. And then when I came here, it is just, 30 years down the line now, when I looked at it, it was a great opportunity. And the purpose when I came here was also not like every jump into coming to another country, but again, I have a very clear vision or things. So just I tested here in this specifically because prior to 1990, I came 2-3 times for to meet the health authority and my medical license. Very unfortunately, it went on. Those days, enrolling here, it is some specifications which are not. The government offered me to start one paid clinic in their government institution. And it took a long time. Then I thought it is just, I'll do my practice back home. And then I came back in 90. But then that relationship made us, in a lot of difference and learning curve. And, basically I have come with the purpose. That's why I can tell you, it is not that, as a simple person, I just come here to not only earn money, but also to see the possibility. And
to serve the very good to
yes,
serve the humanity also. That's what you're doing, right?
Yeah, that's the basic reason I am entered in this country. Initially, what I looked into the community, my fellow members from India, I attracted many of them here from not only the Kerala side but also the entire India, because that's what back home also. Where I lived and in my school days and college days, it's brought up with the mixed people from different states. So it has encouraged very largely, especially the rulers, this part of the world, enough to give an opportunity. So that may be also one reason which my concept triggered here. And while talking this, it's the energy here, it is what I felt it those days, something I can do, what I wanted to be. Yeah.
Very nice. As we understand, you have been pioneer of innovative and affordable and accessible healthcare for low-income group. So tell us, our audience, about your initiatives in terms of making the healthcare more affordable, more accessible, and more innovative, so that everyone can have access to the healthcare, which is a very important aspect in order for you to to make sure you can keep yourself healthy and keep the hope alive and well.
Yeah, Mr. Frank, it's a very, very, because see that down the line, when I talk about 30 years before, I have the opportunity what I'm talking about. Exactly, it's a focused reason I am here, and then I mingle with the Ministry of Health here, the under secretary, who's to I interact many times, and the other the health facility directors. I got a good opportunity to mingle with them, and as I started my small clinic, polyclinic, and then within 5 years time, many clinics I am able to mobilize and then manage, and then I reached a time within the 7 years 26 medical clinics. I mean, it's industrial clinics as well as polyclinics. But again, what triggered me this concept to put it on, because in UAE that point of time, I am now it's almost 10 million people reaching in UAE. But again, that point of time, it's 6.3 million people, where the whole UAE is growing. Then you can see that the roads that day and the roads today, and then you see that the buildings that day and now what is it? All it is constructed, built it like 50-story, 60-story buildings here in a clusters of building and business houses and all. I'm actually to you, I watch very closely the rulers here and then the departments, how they move on to the activities, implementing and the project when they talk about it. But what helped me is that in my clinic, I've seen a lot of people, since I am a social person, people person. So what happened is there a lot of association from India and other, Sri Lanka and Pakistan backgrounds. Each one, they have a lot of association, and there is a lot of good people, and they work together, and they always think how to better life here. They always think back home to support the people. That's the major reason that all the association. And I'm part of the public person. What happened is many requests came from different part of the the association. What they used to ask one thing, that it's more important. Can you help this patient? That patient,
okay,
he's not able to get medical service, so he's not provided the medical card. The insurance not affordable, and there is no insurance. So then what I was looking at as a servicing person. Each time if I see, let's say 20 patients or 25 patients, out of that will be a 4 to 5 patient. Someone like the association sends me, doctor, please take care of them. So what I can do is my service I can do, but I was not in that level today. God helped us. But then what happened is I used to help, and then I used to see the need of the hour. Then parallelly I studied government facility, and the government facility also, they are inviting many medical industry to come here, bigs to come there, come and do this. And I think UAE is achieved largely now good super specialty hospitals. All this, in the time where we started, 80% of the population here used to have a very poor salary. And very especially when I say that it is a person comes from India, Pakistan, or Sri Lanka, Bangladesh, which I'm talking about 80% of the population. If you say they have the maximum. Any person who's having a diabetic problem or hypertension or crisis, they need minimum 300 to 400 dirhams maintenance medicine to see the doctor and consultant, which will go 700, 800 dirhams. But then what happened it happened with my polyclinic, with my cardiologist, my neurologist, and the orthopedician. All that, these people not supported by the the employer, because it will cost them, because if they do the insurance, those days the insurance is like 5,000 to 7,000 will cost. What I thought it is, I started studying in the US HMO program, as well as I studied the medical foundation that they have created a cluster of people to take certain capitation program, all that.
Right.
I don't have any experience than what I thought it is. While practicing, I was learning this US and UK, the background, how they have formed HMO, and then later how they have come up in the insurance. So because that part of the world, that's not that here. So then what I thought it is, how implement. Then I started working on certain organization and corporates, as well as the government entities also. They believed in me, my action, and then they have given certain number of people to manage the outpatient services. And I moved on that, and I moved on.
So why do the people call you people's doctor? The people call you people's doctor. What makes you to have that kind of a name, a people's doctor? That means you really care about the people and your fellow human being, correct?
I think this is the point of this. What happened? It is my intervention, learning curve, moving to the medical insurance schemes, and blending it in 5 to 6 years. And I have made my R&D within my establishment. Then I have taken a huge data, 7 years data, which helped me to tell the government that you don't need to have a 6,000 to 7,000 premium, but still you are able to give them this big population who really need a care, who really need the medical insurance. Thereby, it will be taken care. On the one point of it, medical facility, and the other side, the growing population, they are not getting medical services. So what I made, I brought down this, the premium to 10%, then compared to the 6,000 to 7,000. So this is practice what I did. Almost 100,000 people in 5 years time, and my research went on 6 years. Then I have saying that in 600 dirhams it's provide 150,000 dirhams coverage, which means daily day-to-day issues, as well as up to the cancer, up to the delivery, all that is good. This data I have shared with the government institutions, and they acknowledge to me that to us. And then thanks to God and thanks to people who believed in me in this work, and end of the day, Dubai government announced, and then 4 million people are now insured. So this country now, almost 96% of the are insured. So I am part of it. So that may be one of the reasons as we move on to here as well as Exactly.
So, Dr. Hussain, how do you access the state of the healthcare in India? Did the state of the Kerala have ever asked you to help them to improve the healthcare in India and Kerala also?
Yeah, I think we have we are preparing now. It is certain study, and then even I am interested in meeting the Prime Minister or his team. The preparation is going on for somehow. The concept what I wanted to replicate in India, because it's a lot of CSR fund can support to serve the people. That's the concept which I. But today, I think you see that the last when I call it, it's a 30 years, 3-decade time. If you look into every state, the first city, second city, third city now, it's filled with a lot of super specialty hospitals and a lot of medicine then compared to 30 years before. 20 years, there is a very good growth in medical facilities and the government facilities. So thereby, they started now, bridging them. And they recently, I can tell you, really that Kerala, that it's like, every time we are in the role model to our country, and that has taken even the Nipah virus and you talk about anything that, the health taken care to the 35 million people in Kerala itself, considered as the one of the highest in India. Very recently, we started collecting the medical data for analytical purpose, and then every
Right.
states now started moving that direction. It was not there in earlier days. So this will definitely help, shape up the requirement and the industry point of it, medical drugs, supplies, and other things. So I am very positive about India. We have grown up, and then we are serving many countries. Our neighbor countries, they approach us for any medical treatment, whether it is the small and the very high level subspecialty level or super specialty level requirement. And you can see that many countries are now visiting. The last reported almost 52 countries are coming to India in medical treatment. One another way I will be doing by this insurance scheme, supported by not only the government but also the CSR activity we created and largely, and then that fund will help. So it's not by saying it, such a quantity people to get a medical facility, it's not easy. The cost is also increasing there. We will be definitely taking a big service center. Although population wise, it's a definitely one should think how far it is
Right.
suitable. But gradually it is appreciating and progressing.
Dr. Hussain, you have been very successful, and it is your to give back to the country and to the people, because make them successful. So you have given a lot of scholarship program in India and the other part of the world. Tell us a little bit about what have been the success story of you providing your helping hand, you extending your hand, your hope, and help those people, and especially the people who are socially and economically disadvantaged, who are underprivileged, and you help them out. Tell us a little bit about that, Dr. Hussain.
Yeah, at this point of time, as I said, mine is I'm one of the God-gifted people here in this part of the world, where we moved on public support and not only looked at the commercial, but if you see that all the concept what we made and they'll be largely accepted. So I have a certain level of piece of cake I've also received, so that the business is growing, so that every time we carefully move on. I am, thanks to God, in a debit-based company. I don't move on very quick and large in a step-by-step manner. So what happened is God helped us, to support back to the people. So what we have created our own charitable trust, where we see that the people need state at a different level of it. I do more on it, as well as the education is the poor people. Like the UAE is now more important. Many people who work here, and I have seen that the best role model to the entire world. What they do is that they work here, and the time they associated in some of the evening time as an association, and sitting there gathering, and not only that just gathering, but they think about back home, the people who are suffering, and their need is always supported by them. This is the beautiful thing I used to see. So like they have come up with many associations. They come up with, they want education scholarship program. In my own state, and now it's a 14 districts in Kerala. We created the dialysis centers in all the general hospitals. Not there in 2012, and now it's we moved on with our initiatives. We have facilitated now all the 65,000 people are getting the dialysis. Every month. This is all. It's like the bit and piece of it. But again, all that the success story, when I did it for the public purpose, the service here, that made me earn the part of the earning. It goes to that, and joyfully I'm doing it. So as long as God gives me, that is what I should do, and I feel it is, it's my duty.
It's your responsibility to help and nurture other people. So, Hussain, before we change our, before we, close our session, do you have anything for the audience that you want words for the people who wants to be like you one day, a doctor, and help others?
Of course, it is like, we need to, just if at all, if I am able to talk about a small success story, in that,
Sure.
the hard work is the very important one. And then these days, there's a lot of young people, they are looking into the fashionable one, but again, how hard work they will take it as a challenge, because the world is changing and the environment is changing. And if I talk about, once, I was talking to my daughters as a profession, time to time we have, and I used to go and tell them I did this and I did that and all that. So after a long period later, my daughter, once half an hour session, and she said, let me go out and then see that what you said. And then she opened the door and then just come back and said, Daddy, whatever it is you're telling me now, that's not available outside. But then what you said last 30 years, your experience is not the environment what we are having. So when she said that, I really surprised and I understand, okay, I've been teaching it what I'm not talking about what they are facing and what they want to do on. So my valuable, to the young entrepreneurs, one should work hard. And sometimes I think I made a mistake with this, but the struggle and keeping faith on the work what we do and analyzing properly, this will help me to come up with that. I think one has to look into that, because what you do, you analyze properly and test it and move constantly and then reach where you wanted to be.
Very well said. Aim high, work hard, pursue your dream, and you will get the strength and courage when you sacrifice. And that's what you said.
Exactly.
Very well said.
Yeah.
Thank you very much,
Exactly.
Dr. Hussain, for coming to our show. Thank you for watching. This is Frank Islam wishing you a great week.